Hi everybody, it's Honest John again. Now, as many of you know, I worked for years as a psychiatric nurse before I became a comedian. Actually, my official title was Licensed Psychiatric Technician. I wasn't an RN or an LVN. My specialty was psych. But part of my training was at a medical hospital. And I would put in a full day caring for medical patients and learning the things that RNs and LVNs do. This was about as hard as I have ever worked in my life. It's part of the reason that nurses are my heroes. I would finish the day exhausted. Now, one of the things that you do when you're working in a medical setting is to try to prevent the spread of infection from one patient to another, and of course to yourself. So you wash your hands a lot, and not regular hand washing like everybody else does. This is meticulous and exacting scrubbing of the hands that actually takes several minutes. Well, while I was doing this training for several days, I was assigned to a patient who was in isolation because he was very infectious. I don't remember exactly what it was that he had, but I remember when told about this assignment, I was a little scared. And I felt it was a lot to ask of a student, but I did my best. Now, he was not the only patient that I had, so I had to be extra careful to make sure I didn't get myself infected or spread the infection to the other 3 patients that I was assigned to. Before I entered his room, I had to completely gown up with a cap, a mask, booties on my feet, and double gloves. It began with a thorough hand washing, and then I'd put on all this protective gear. And when I would leave his room, there was a strict protocol for taking off the equipment, which involves, as you're taking this stuff off, you're turning it inside out so that the parts that have been exposed to the patient are now inside out, and it makes it safer to dispose of them. And then at the end, another hand washing. It's a difficult process. And as you're taking off your gown and your cap and your mask, you're trying to avoid contact between your skin and any object that might be contaminated. And it's very difficult to do this exactly right. So when I heard about the nurse who contracted Ebola in Texas, I thought back to my own experience with infection control and how difficult this process is. It wasn't like this nurse was being sloppy. This is a difficult procedure, and even if you do it exactly right, there is not 100% guarantee that you won't become infected, because human beings are imperfect, and even if you follow this procedure exactly, you might brush your skin with something that has been contaminated. That's just an uncomfortable fact of a nurse's life. So when you see a nurse, you are seeing somebody who's very conscientious, who's very hardworking, and who's incredibly brave. Nurses put themselves on the line every day for their patients. We usually associate courage with soldiers or policemen, but medical caregivers are just as brave and bold and take enormous risks every day, just as much as soldiers or police or firefighters do. Our medical caregivers are on a battlefield, and it takes a lot of courage to be there. Thanks for listening.